This is lab 1, station 1. This is about the skull. So we're looking at the human skull here. I'll just show what we're looking at. I'll rotate it around for you. All right, we're going to look from a posterior view here. And first it talks about the sutures of a skull. We're going to move to this model because we can see this better. The first suture we're going to mention is a coronal suture. This is the coronal suture. On this model, this is the coronal suture. The sagittal suture is this suture here. On this model, this suture. The lambdoidal suture, you can see here, separates the parietal bones from the occipital bone. We turn the skull on the side, we can see the squamous suture. This is the squamous suture. And then if we look at the fetal skull, we can see the metopic suture because it's usually gone in the adult skull. Again, this is rostrally, so it goes from the frontal fontanelle down toward the nasion. Intersections of sutures, where the coronal suture and the sagittal suture join, is the bregma. Where the sagittal suture joins the lambdoidal suture is the lambda. This is the pterion. This is the asterion. Fontanelles. This is the frontal fontanelle. This is the anterior lateral fontanelle. This is the posterior lateral fontanelle. And then the posterior fontanelle is back here where the lambda. We move from here to the frontal bone. We got the frontal bone here. We're going to get embryology here in a second. First we're doing all these stations. So this is a station, station 2, the skull. With the frontal bone, the frontal squama or squama is a flat part of the frontal bone. The supraorbital arch is this area right here, sometimes called an arch or a ridge. On there is a notch called the supraorbital foramen or notch. The superciliary ridge is here. Cilia means hair, so this is where your eyebrows are. The area in the middle is the glabella. Then the bregma we mentioned before. The parietal bone, parietal means wall. Parietal is the side of the skull. We have parietal foramina, which are holes on the parietal bone. Their location varies. We also have temporal lines. The temporal lines are difficult to see here, but you can kind of see them extend here onto the frontal bone. They'd come up here on the parietal bones. They're for the temporalis muscle. The occipital bone is the base of the skull. This is the occipital bone. It has the foramen magnum. It has the external occipital protuberance, which is this bumper here called the EOP. We have the inferior nuchal lines, the superior nuchal lines, the occipital crest. The hypoglossal canals, which is where the hypoglossal nerve resides. It's right here. You can see it here. They're just superior to occipital condyles. Then inside the skull, you can see what's called the clivus. The clivus actually consists of both the occipital bone and the sphenoid bone. This is the clivus, or clivus, some people say. Okay, go to station 3. This is station 3. Continue with this. We're talking about the temporal bone. This is a temporal bone right here. This is a temporal bone. You can see this process. This is called the zygomatic process because it projects toward the zygomatic bone. There's a fossa on the zygomatic, right below the zygomatic arch, called the mandibular fossa for the articulation of the mandible. The mastoid portion is this portion right here. You can see this mastoid process. There's a hole located between the mastoid process and the styloid process called the stylomastoid foramen for cranial nerve number 7. The tympanic portion, which is where the external acoustic meatus is here. There's the external acoustic meatus, and here's that styloid process we mentioned earlier. The petrous portion is this portion right here inside the skull. We have a groove for the sigmoid sinus located here. Now the sigmoid sinus is no longer there, but the groove where it was is. And here it extends toward the groove for the transverse sinus. The transverse sinus groove is where the transverse sinus was. This is on the occipital bone. So that transverse sinus comes down here, goes into sigmoid sinus. and out the jugular foramen. We have the carotid canal, which is here. And we have the bones of the middle ear. This is a little hard to see. Here's the malleus, here's the incus, and here's the stapes. All right, go to the next station. This is a sphenoid bone. And here we have the skull, here we have a sphenoid bone. This bone fits into the skull like this. We'll use both models to show these structures. We have a lesser wing. The lesser wing of the sphenoid bone is this structure right here. The greater wing is this whole entire structure right here. The greater wing of sphenoid. The body is just a central portion of the sphenoid bone. I've got it by the body. The jugum is where the two lesser wings come together, located right here. We have the anterior clinoid process here. We have the chiasmatic groove. Netters labels this as pre-chiasmatic groove, same thing. We have the groove for the internal carotid artery, which is this groove right here. If we look down in the inferior aspect, we have these pterygoid plates. We have medial and lateral pterygoid plates. We have a cella turcica, which is where the pituitary gland sits. Dr. S will tell you about this in Cells and Tissues. This is the tuberculum cellae, hypophyseal fossa, dorsum cellae. Then the ends of this are called the posterior clinoid processes. We have numerous holes in this sphenoid bone that we're going to need to know, and they're kind of hard to see here. But if you look inside the orbit, if it'll focus here, you can see that hole up into the top where, go ahead. This is the optic canal right here for cranial nerve 2. This is the superior orbital fissure, cranial nerves 3, 4, 6, and V1. This is the inferior orbital fissure for V2. We go inside the skull. We can see we have the foramen rotundum, which is here. You see that on the video, foramen rotundum. For V2, here's the foramen ovale. For V3, there's a foramen spinosum. All right, we'll go on here to other bones of the face. We have, this is lab station 5. We have the ethmoid bone, which is here. If this sat in the skull, you'd put it like this. There it sits in the skull. You can see the crista galli right here, and then the cribriform plate. You can see the median perpendicular plate here from the front side. Here's median perpendicular plate. And while we're here, we'll mention here's the vomer bone. The maxillary bone is this bone here. We have the infraorbital foramen. The nasal bones are here. We have the internasal suture. The zygomatic bones or cheek bones are right here. And we have a temporal process of the zygomatic bone right here. We have a frontal process and a maxillary process. The nasolacrimal duct is a tear duct which sits right there in the nasolacrimal fossa. The vomer bones I mentioned is right here. The palatine bone you can't see well. It's actually part of the orbit right here. And then the hyoid bones in this model right here, this is the hyoid bone. All right. We go over here and we have the mandible. This is the mandible. This is station 6. We have the mental protuberance, which if you look at the skull, this is the mental protuberance right here. Then on the side we have the mental tubercles. We have a mental foramen right here for the mental nerve. We have the angle of the mandible. This is the body. This is the angle, and this is the ramus. We have the condylar process right here. And we have the coronoid process. Also, if we look inside the mandible itself, we can see a little projection right by the mandibular foramen. This is the mandibular foramen right here inside, and then this little process is called the lingula, or tongue-like projection. Okay, Okay, bones which form the orbit is station number 7. You can look at these and find these in netters. Here is the orbit. I'll try to point these out to you the best I can. This is the frontal bone. Inside here is the lacrimal bone right here. Then we have the ethmoid bone. We have the sphenoid bone, which is this bone back here. The maxillary bone, which is this bone here. The zygomatic bone, this bone here. And then the palatine bone is this little tiny piece right inside there. It's hard to see. Okay, then the next station we have the holes of the skull and what runs through them. Okay, and we pointed these out on previous models. Then we have the embryology section here.
So, okay, here we go. This is the fertilized oocyte, and you can see that the sperm has successfully entered the ovum, and it follows by the formation of the zygote. After the zygote forms, we go through the stages, which we call it cleavage. Cleavage is increase in number of the cells. We see the 2-cell stage and 4-cell stage and 8 cells, and ultimately end up with the formation of the morula. Morula is a compact ball of the cells. After 24 hours later, after the morula, we have the blastocyst. Blastocyst is a structure that is made of inner cell mass, which forms the embryoblast, or we can call it embryoblast, and this is the one that formed basically the embryo, which inner cell mass, and the layer that covers this whole structure, we call it trophoblast, which give rise to the placenta later on. And we have also blastocyst cavity. Then we can see the implantation is happening in the endometrial lining. This is happening day 6 or 7, and what you see here, basically you have trophoblast layer here has given rise to the cytotrophoblast, and we also have sensatio-trophoblast here, which is basically, this is the part that sitting in the endometrial lining. You have epiblast and hypoblast or forms, and the embryoblast has given rise to these 2 layers, which is, this is called bilaminar germ disc. Also, you have the formation of amniotic sac, which is forming between epiblast and also and trophoblast here, the cytotrophoblast, or you can call it also trophoblast here. So the next stage, as we go further into the
Station 10.
Station 10, as we go further into the pregnancy, this is about day 12, and you can see the blastocyst now has been changed, and you have this chorionic cavity that is formed. Instead of blastocyst cavity, we call it chorionic cavity. The chorionic cavity forms the, also we can also call it chorionic sac. The wall of chorionic sac is called chorionic membrane, and this is basically chorion. Chorion has this finger-like projections that we just call it chorionic villi. Also, you can see the inside this chorionic cavity, you can see the 2 germ layer, epiblast and hypoblast. You see amniotic sac here, and also you see the yolk sac. These are all suspended by this structure, which we call it connecting stalk. So these are all inside this chorionic cavity. And then we go further. This is about day 20, and you can see the amniotic sac has been increased in size, and also yolk sac has increased, and these are all suspended inside the chorionic cavity. And the big difference here, you can see the way the chorionic villi look here is like bushy or everywhere. Now they're becoming more organized, and they become more prominent, and they are throughout the system. These are all coming from chorion, and they give rise to the placenta parts.
Where's the baby?
Oh, the baby is here. Baby here. Okay. So the next one, as we can go, this is about a month old, and this is 2 months old, and you can see now the embryo in a good shape. You can see the somites, you can see the you can see the lower limbs, and also you can see the pharyngeal arches. You see the head and neck region, and that's the embryo. But what you will see, instead of the chorionic cavity, now the amniotic sac has been increased inside and covers the whole baby. So basically this fluid here now is amniotic fluid, and amniotic sac is being fused to the chorionic sac, and you form one membrane only here. So this too is a fusion of amnion and chorion here. Okay, and these are the chorionic villi that you can see all throughout. You also see the yolk sac here, and you see the connecting stalk here, which is attaching, which shows this is placental circulation, and also the villi are becoming more organized. This is about a month old. So the next stage, which is like 2 months old, you see the embryo is growing bigger, and what you see as you're expecting, the yolk sac is becoming smaller and smaller, and basically the chorionic villi that were throughout, that you seeing throughout the membrane is coming out into the endometrium. Now they're going to be mostly fused into one area. It would be concentrated into an area which is connected to the endometrial lining and basically the placental formation. You see, this is called chorionic. These are all chorionic villi, and this part is called chorionic frondosome, which means like the chorion here has the most villi here, because this is the side of placenta, you know, that forms. This is all placental circulation. Now the yolk sac has been incorporated into the connecting stalk. Then we have the umbilical cord formation, and you have this amniotic fluid which is surrounding the membrane here. And the parts of the part of the chorion that does not have any villi is called a smooth chorion, or chorionic lavy, which is, lavy means smooth, because all this chorion, which is chorionic villi, which is coming from the baby, is being focused in one area.